paddles are generating more power, and with more power comes more intensity, and with more intensity comes more physical demand, and with more physical demand comes higher injury risk.
I had an issue with my left hip, and you guys just completely fixed it.
So the majority of the injuries that I typically see from pickleball are...
That's like one of the biggest predictions that I have for the sport is
Not all PT is the same. Just like not all doctors are the same. Not all orthopedic surgeons are the same.
Would you recommend cross-training or for any sport in general?
Initially,
should you play through pain if you have a little shoulder injury or if you tweaked your shoulder?
I think there's so many.
Today, I'm joined by Carlos Reyes, founder of the Reyes Performance Institute and a leader in blending advanced physical therapy with elite sports performance training. Carlos has worked with athletes with a wide range of sports, helping them prevent injuries and setbacks, as well as increase their peak performance. Carlos has worked with a wide range of athletes, helping them prevent injuries and setbacks, as well as increase their strength and performance through evidence-based methods. Alongside him is Dr. Henry Klein, an orthopedic and rehab specialist working in Austin for over 5 years with top orthopedic surgeons. Together, Carlos and Henry bring an unmatched expertise to keep players healthy, maximize performance, and build long-term longevity to the sport. And I cannot wait to dive into this conversation. So ladies and gentlemen, I welcome you, Dr. Carlos Reyes and Dr. Henry Klein. Thanks for coming on.
Yeah, thanks
Dad.
Appreciate it.
Appreciate it.
Yeah, so I've been partnered with you guys for a few months now. I mean, when was the date that we actually started?
Oh, I want to say back in, was it June? Right?
Might have been earlier than that. Yeah, we've been working on it for a couple months now, for sure.
Yeah.
Maybe say like May.
Yeah.
And so, I mean, I've loved my time with you guys. I actually, literally, as soon as I walked in, I started, like, that was when I was having issues with my body. And I'm not very, I do not tell people the health issues that I have, of course, because I don't want other pro players to know that. And then, when I play against them, pick on that. So I'm pretty quiet about it. And so being able to come to you guys, and you guys, I believe the first 2 or 3 weeks, you guys actually just tested where I was, and then just made sure to do PT, and then built an entire structure for me, tailored specifically to me. And I think that's what RPI has done really well for me, is you guys have fixed the problems that I've had, not only from completely fixing my lower back and fixing my mechanics on the court, to actually, whenever I came in two weeks ago, I had an issue with my left hip, and you guys just completely fixed it. Now it's completely fine. So I really like that about RPI in specific.
Yeah, absolutely. I think initially when we first had our talks, right, and our discussions, I felt like you were going to multiple people. And I think it was kind of very difficult for you to kind of buy in with some of the techniques that were being, administered to you. You weren't really seeing, the end product of what you truly wanted, your result. And that for me specifically, was concerning. I wanted to ensure that, the vision that you had, or what you had disclosed to me, was something that, you actually achieved. And I felt through us and through Reyes Performance Institute, specifically through Henry and I's expertise, that if you came to us, that we would be able to create a well-rounded, comprehensive program that not only included physical therapy, but strength and conditioning, sport-specific training, things that Henry has gone through these programs with you over the course of this time. And that's where I felt like that's where you were going to find the best bang for your buck, and which is why I felt that RPI was going to be the best for you.
Yep. And you're spot on. When I was dealing with that, I was spending so much time and so much money into just throwing everything that I could on it, weird stuff, whether it's herbs and spices, to higher tech stuff, to literally just going back to the grassroots of, just how your body works. And I'm glad that it landed on you guys, and I've been able to reap the rewards. Yeah. But let's start a little bit about how RPI began originally, how long you've been in this. Obviously, both you guys are very, very, you guys have a lot of accolades, but let's talk about the beginning.
Yeah, absolutely. Reyes Performance Institute was started about 3 years and a few months ago. I got tired of just the corporate traditional clinic. Henry and I have been part of that model for a long time. And one of the key things that we found that was sacrificial within that time is our ability to spend time with people, and provide, physical therapy to its utmost of what we were trying to achieve specifically in our own clinical expertise. Him and I are both, involved in a fellowship program. We felt that we could, give our best expertise if we had enough time with people, and we just didn't have that. And so that was one of the reasons why I started RPI specifically, is so that I can afford people one-on-one time, and then provide them with every single thing that I could and every single tool that I could within that session. And so hence with that timing, and I think Henry can attest to this, is the ability to now connect to people like you, people that we care about, people that we're going to show compassion to, empathy to, love to, like treat them like as if you were my brother or sister or whatever that looks like. But within that timing and through the accumulation of that time, then we would build something grander than just being a patient, that you would actually be someone that we cared about more often. And so that's where kind of Reyes Performance Institute, and it just kind of evolved as we do, physical therapy. That's kind of our bread and butter. But like you said, we have a lot of accolades and things like Racket Fit certifications through Henry, and strength and conditioning specialty with me, and our fellowships in sports physical therapy. I'll let Henry talk a little bit of what he thinks, RPI is, but that's kind of how, developed essentially.
Yeah. Coming from the same model, you always feel like there's so much you want to do, but you just don't have enough time to do it. And one of the strongest pulls to coming to this company was feeling like I had my own autonomy over the PT I could provide. I do think there's kind of a little bit of a framework for traditional PT in which you can actually provide to your patients. And in this setting, right, like it's totally functional to what you need and what we need to do for you. And the world is our oyster for that. So many resources, so many different avenues that we can go through to kind of accomplish that. And I also felt like Carlos was saying, the connection between patients is so much stronger. I feel like my patients understand better too, because I have more time to give that to them. And it's just so much more personalized, which I take a lot of pride in. I want to make sure that every patient that I see feels totally understood, and make sure that their whatever they're dealing with is totally apparent to me. And I feel like RPI does a really good job with that. And so it was an easy no-brainer to work with Carlos on this. And it's just, I think it's also shown in our patients that we've seen. People seem to bounce back really well and come back stronger, better, fitter than before. And so I just think it even further supports the model.
So both of you coming from the corporate world, what makes RPI truly different comparative to where you guys came from?
Probably one of the biggest things that we're not seeing 20 to 20 people, 22 people in a day, honestly. We see 6 to 8 on an average time, and we see you for 60 minutes. We are a cash-based model, so that means that we deal with a little bit of insurance, so more of like a hybrid. And so for those reasons alone, we get to offer you a lot of different techniques and tools without the governance of someone else's insurance agenda. I don't have to do a lot of authorizations to get a certain technique done or things like that. And so that's a huge difference that we usually see. If it's not the actual, visits that we see per day, it's going to be ultimately the time that we spend with you.
Full one-on-one hour of time, which I don't know if Carlos can agree, but coming from traditional PT models just feels like an enormous amount of time. In traditional models, sometimes you have overlap. So not necessarily do you have people coming in, but you have 2 or maybe 3, maybe 4 patients that you're responsible over a period of time. And so it's multitasking with one person over here while working with someone over here, while working with someone over here. And so I don't know, over time, it just felt like I was giving a disservice to my patients, right? So like, I can't give them everything that I want to give them. And as an altruist and someone that just wants to give as much as I can to everyone I work with, it felt like a disservice. And I take a lot of pride in the whole one-on-one aspect that we give here. And I think that's something that also speaks to us, is it just feels better that way, and the outcomes are better that way.
Yeah. Like what I'm used to with like the legacy PTs is kind of like the dentist approach, where like the dentist comes in for 2 minutes, checks on you, says you're good to go, and then dips, and then you're always getting pawned off. You're always dealing with the assistant or something like that. Now let's talk a little bit about your guys' accolades. I know your Racket Fit certification is something that makes you like very, very unique, specifically in Austin, as well as your guys' fellowship. So do you guys want to dive deep into that?
Sure. So my Racket Fit certification, it comes off of a branch of certification work called TPI, which is Titleist Performance Institute. That's more golf. Screening is where it kind of originated from. couple coaches and biomechanics guys got together and thought, hey, we should come up with a program that really kind of, looks at the biomechanical faults in tennis, predominantly serving, forehands, backhands, and kind of tie that into like the rehab or PT model, like finding little faults that maybe you could see in various serves, and then what you could do with those faults, like how you could see them in a various injury or in a functional limitation. And so that's what the whole RECOFIT certification really helps with. I by no means am a coach, right? So I'm not coaching anyone on their technique or whatnot. But the RECOFIT certification allows me to feel like I can kind of jump in that field a little bit and get like a good understanding of like, okay, like based on your mechanics, we could tweak a couple things here and kind of work on that as well. So the RECOFIT certification really helps me with that. And I've seen it tie into other sports like, padel, pickleball, anything that kind of involves a racket or any kind of paddle of that nature. So, and then the IR stuff, Institute for Athlete Regeneration. So I started that program a couple years ago. And its main focus is just to elevate orthopedic and manual physical therapy. The goal is to kind of bridge rehabilitation with athlete performance. So allowing us a lens to kind of close that gap a little bit better. Because over time, what I realized there's a strong disconnect between rehab. Traditional rehab kind of would end at like a specific period in time. And then, there'd be a gap, and that gap would be, well, are you working with like a strength and conditioning specialist? Are you working with a sports performance coach? What are you doing in that gap? And I think the fellowship really helps with that. So you can allow your patients to progress through that towards their sport, where there's a little bit more continuity. There's not a big gap between that. And then I don't know if there's anything more you want to tie on with that.
Yeah, I think we'll probably need like another hour's worth of podcasting to go through all my stuff, because story is very similar to kind of just the perseverance that you've shared with us on things that you've come back from and what's led you to kind of your successes is very similar to just my career as an athlete growing up. Had multiple injuries, which led me to want to do physical therapy. But I wanted to know everything exercise science. Like that was my bread and butter. I love exercise. I grew up in a world of exercise. My mom and dad are literally athletes. My dad was a bodybuilder, still is. Like I grew up in a gym, essentially like a gym box in our garage. And so we called it Jim's Gym. Like that's what I was doing. So I was lifting weights at, 5 years old. No, not 5 years old, but essentially, I wanted to know everything exercise science. And so I became a strength and conditioning specialist prior to becoming a PT. So I did a graduate degree in exercise science and undergrad degree in exercise science as well. And everything I wanted to know about exercise A to Z. And that's where I love like doing needs analysis and biomechanist and exercise physiology, like tying all that into now on the medical side to things. Now I'm thinking more in terms of like, okay, what about injury prevention? Like how can I now substitute maybe this exercise because I know exactly what a muscle is doing, particularly in this motion for this particular movement that we're doing in pickleball, right? Like, so then it goes even further than that. Now, as a sports physical therapist, I went into a program called a sports residency. Now, sports residency is right before becoming a fellow. I just wanted to make sure that I was engaged in some things that were a little bit more like sport performance, but under the scope of like the medical field, under the scope of physical therapy. So I was going on the fields and doing, like, you've ever seen those people that run onto the field and they check, if you tore your ACL or if you got a concussion, right? I'm that person, and I still am. I can do that. And then also I've gone into now the program, just like Henry has at Institute of Athlete Regeneration with the fellowship as well. So my motto has always been, I think I've shared it with Henry, is ability to take care of an athlete from A to Z. I want to take you from the beginning of your injury or whenever you come to me, get to the point of back to performance and then beyond and everything in between that. I don't want you to feel like you have to go somewhere else other than where you're at with me. And that is the ability for us to then think comprehensively and critically to then drive you and navigate you through those steps so that ultimately you're successful and we're successful at the same time.
So rather than just PT for a month and then giving someone exercise that they never do.
Exactly.
That makes sense.
Exactly.
Yeah. And what I really like is you guys have this umbrella of experience where like we've planned some of our sessions where like we were going to help my lower back, and my lower back felt fine going into the session. And so I literally told you at the beginning, like, hey, actually my hip feels a little off, right? Like I feel like I tweaked my shoulder, and then you just adjust immediately. And then the 60 minutes was spent towards fixing that. And then I'd walk out and it'd be completely fine. So you guys obviously, what you guys, I assume, just learned was how to deal with tennis, the functional training with tennis and all of that. Now that pickleball is getting a lot bigger, pickleball is kind of overtaking it, if I were to assume, with a lot of your clients. So let's talk about pickleball's relationship with tennis and other racket sports and the common injuries that we see. Are they related between all racket sports, or what makes pickleball different?
Okay. I see a big gap between the two. There are some that are a little related as far as injuries, but there are some that are kind of in their own different field. Pickleball is just such a welcoming sport. I think the learning curve to get started is a little bit gentler than maybe tennis, and so you get a lot of people that play. But I think the thing with pickleball too is it can be something that you got a paddle and you're drinking a couple beers, sitting around with some friends. It can be really social and relaxed
stretch.
setting, right?
Never stretch.
It can be a really social, relaxed setting, right? But then everyone has a little competitive. Everyone's got a little competitive fire, just like Carlos, my compatriot here. He has one too. And then you just push the envelope, right? You're like, well, you know what? I think I could push this a little harder. I could go for another shot, go for another ball. So the majority of the injuries that I typically see from pickleball are soft tissue in nature, Achilles. Actually, I played with one guy that popped his Achilles playing one time. So Achilles issues. Knee, it's a lot of force and load on the knees because you're squatted, you're bent down for the majority of your play. There's a lot of pressure on it. And then low back is probably the third most common, just based on squat form, squat mechanics, where you're putting the majority of your weight. A lot of people tend to put a lot of weight through their back just because of limitations in other areas that are not as mobile. So back stuff there. Where tennis, yeah, you see a lot of back stuff. With my tennis guys, I see a lot of high school tennis players, and there's this big like machismo energy with like, I need to have the fastest serve. And so kids are doing whatever they can to generate a lot of force, and that's just a lot of wrenching and load on their back. It's a lot of back stuff, but then shoulder, right? You're taking a lot more force through the ball in tennis, specifically with a serve, where with pickleball, it's staying kind of at waist level or a little lower. So not as much demand on the mobility or just overall strain on shoulder tissue as maybe more of like back and lower extremity. So more upper body with tennis for sure than I would typically see with pickleball. But some are similar just because of the rotary aspect and kind of like how you're cutting for shots and you're moving within like the same kind of confinements almost as far as a surface. I know the court is smaller in pickleball, but the movements are kind of similar to some degree. So lower body's kind of the same, but upper body's a little different.
Mm-hmm. Yeah, I've seen that with my dad. My dad played tennis like growing up until he was like 30 or 35, and spinal fusion, Tommy John surgery, like wrist issues. Then played pickleball, nothing. Literally nothing.
For sure.
So I see that commonly. But what about endurance or like rotational stuff, or what I see most commonly, which I think the younger generation is going to have a lot of problems with growing up in pickleball, a lot of wrist pain. But what do you guys see as well?
Not necessarily. Well, I haven't seen that too much. More specifically, like things that I've seen coming from pickleball injuries are my ankle sprains, and this is more from like my geriatric population, people that think they can just go pick up a racket and just go play because their buddies are playing, right? One of the thing that gets overlooked too is that when people fall, like that's the things that we see too, is that they don't know how to fall. There's no coordination of how to fall because they will lose their balance, they'll lose their coordination of their feet. They put their hand down, and that's when you start seeing some of these fractures happening of the wrist or of the we call radius and all that anyways, but that's usually what we have. Forearm fractures, we saw some hip fractures, we see definitely some ankle sprains. One of the earlier ones that I saw was a concussion because the lady fell backwards because she was trying to go over for a lob, right? And she came back and she hit right on her head, came in for a concussion. That was the first concussion I'd ever seen from a pickleball game, and I was like, dude, that is a real thing, right? Because they just don't have that depth perception, especially in my geriatric population. Maybe not so much in my youth or my younger population, because they do have the adequacy and capability of actually moving back and forth and having that depth perception. But yeah, I would say that I think one of the biggest things that I see specifically in like my tennis folks versus like my pickleball folks is that serving capacity. Is that in tennis, you have like all these higher powered movements that are happening within the shoulder. I used to see that a lot. But with pickleball, it's all underhand. Like we rarely see, especially like my pitchers in like softball, for example, it's rotational stuff, but they're all underhand. They can go pitch after pitch after pitch. It's almost like a normal motion. But in baseball, overhead pitchers, dude, that's a lot of injuries that are happening from all those mechanics. And it's a very similar mechanic when you're doing the, swing versus the underhand serve.
Gotcha. So is it just more natural to go underhand, just body-wise, rather than overhead, like over?
It's just more, what it is it's just less stress on the tissue because you don't have what we call a peel back mechanism of those structures. They don't get to ring as much. Everything else is literally starting off low, and I get to stay within a comfortable tension position of the shoulder ligaments or the structures that live in there. So then there's less likelihood of an injury per se that can happen within there. Now, when overuse can happen, yeah, I think overuse can happen, but maybe less likely of like a ligament tear for that matter.
The further anything is outside of your base of support or just your axial spine, and you're going really quickly through it, the more load it's going to take. Your shoulder is such a mobile joint. Its main responsibility is to provide all these degrees of freedom. So when you do anything with a lot of force in a joint that's really mobile, you're always going to put yourself potentially at risk for something to happen. But to talk about your wrist stuff, I would say that tennis is a lot more body control and generating momentum through your body on a lot of shots, right? So like pickleball is a lot of punching and popping. And so you do have a little bit more wrist involvement than say you would in a tennis stroke where volleys and whatnot, you're kind of keeping the wrist locked out and you're using a little bit more trunk, a little bit more hip to kind of generate force. So maybe that's something that we do start to see more of as people are kind of gravitating more towards the sport is like, hey, it's a little bit more wrist poppy and a little less body contortional kind of stuff. But as far as the ground strokes are concerned, they're virtually the same. But I think probably some of that like at the kitchen net play stuff is maybe where you're getting a little bit more wrist involvement.
Yeah, and that's something that I've seen personally. And that's like one of the biggest predictions that I have for the sport is I've seen so many kids, specifically kids, say under the age of 22, that like, that are pretty slim or just like on the weaker side of things. They rely a lot more on their wrist to get power because, you're 22 feet away from the net. So you can just do all wrist. And the younger generation is doing a lot more wrist. So like at the English Open, in my finals, 2 of the people on the court had either like their wrist taped or just an issue with their wrist. So I see that way too often. I've had some, but it typically stems from how you weight your paddle, as well as some of your mechanics. For example, when you see people do this like inside out tomahawk or scorpion, this mechanic right here is very uncomfortable. So a lot of the people, I've seen 3 players have major wrist injuries because they're just doing this rather than a backhand.
Yeah, absolutely. And innately you're doing that over, it's super repetitive, right? And it happens within like seconds, right? As you're, going across from each other, right? In tennis, it's not so much that you have to wait for the ball to hit the ground and then you're going to come back, right? Then there's a lob and I can hit it. But in pickleball, you literally are like, 10 feet away and we're just literally hitting it back and forth. So I think the idea, the goal is to like obviously hit it as fast as you can or as reactionary as you can. And so because that doesn't require for my entire body to then spend less time doing this and then get into position, my main objective is just to get it back and there goes my wrist, right? So I'm going to constantly be doing that a lot more.
Yeah. Plus, I think in pickleball, your wrist isn't like when you're hitting volleys out of the air, your wrist is almost never locked. In tennis, your wrist is always locked. Like you're hitting the backhand, wrist is locked, so your wrist is solid. Forehand, still locked, your wrist is solid. In pickleball, you're hitting these counters and your wrist is in a very weak spot. You're just trying to snap through it. Or when you're hitting a forehand volley, notice how my wrist is dropped. And so if you shank it, if you have tape on your paddle and so it's heavy up here, you shank it and then swing through it, then that's where you're going to get that's where I see a lot of those wrist issues stem from.
For sure.
I'd even say it's just the whole play of the kitchen. So in tennis, right, you're free to go wherever you want. And so with a lot of volleys and shots, it's a lot of lower body guiding through hips and trunk, and then upper body taking some of the brunt of it. Just like a thrower, the majority of their power is coming from your hips. If you're planted at the kitchen, and you're supposed to be planted and you're not stepping in or moving, you're totally isolating your lower body. So you're getting no lower body involvement on any of your shots because you're fixating it in that spot. And so then you're forced to, in weird spots where you have to make a quick, instinctive decision to use whatever you can use. And in that case, it's going to be wrist and elbow, right? And I think there's some element to like, hey, I can't step into this kitchen line. I can't have my body continue forward momentum. I have to stay planted. That forces your upper body, specifically wrist, elbow, shoulder, under greater demand, because now I have to use that to generate my power instead of what we would instinctively normally want, which is your trunk, like your core and anything that kind of crosses your like you want that to generate a lot of your power, and you're stuck because your legs are fixed and your body is fixed. So I think hopefully we'd start to see more players that kind of involve a little bit of, I would imagine, pelvic, hip, lower back rotation for strength, right? If you could get that just at a small microcosm, then you're using so much less wrist, and then you take the demand off of that. So I think some of it is like, you want to chicken or egg it, right? Is it the mechanics of the sport? Like, is it the kitchen line that's limiting it? Or is it that some players are coming from different sports, right? Like, I wonder if, any of the people that have wrist stuff came from tennis, or, we've talked to a bunch of different people who come from different sports. You got badminton, a couple have come from basketball, all these different sports that are pulling people towards pickleball. So you're going to get all these different movement analyses for everybody because they all move differently based on their previous sport. So I think that's probably something that's also a factor in some of that too.
Yeah, no, that's really true. And I think there's like 3 different things I want to talk about there. I really do wish you were right, where like we're going to see more, or like we want to see more hip involvement. But with the way that the game is going with more and more wrist, I think we're just going to naturally see more injuries, more taping up your wrist, because like wrist is unfortunately the future.
Yeah. And I think the caveat to that is now knowing that piece of information and that resource is now, Henry and I now get to develop programs to help with that now, to then try and prevent some of these injuries. And that could be some of like our specific exercises for wrist, and hand stuff, forearm stuff, where we do a lot of like resistance training, stabilization training, mobilization training. Sometimes, getting into these scorpion-like positions, oftentimes you don't even have full pronation or the ability to even get into those positions. So now my wrist has to take that because it's way more mobile than what my forearm allows me to be. So there's a limitation here in the ability to get here. Well, I still want to get there for the shot. So what am I going to do is I'm going to try and get there with my wrist, right? So then now becomes way more forces happening upon the wrist. And that's something that Henry and I are really good at as we analyze that stuff. We take exactly what you just told us. Okay, now let's devise a program to ensure that 1, it doesn't happen to you, and 2, it doesn't happen to all these other players that are getting some of these wrist injuries.
Yeah, and I've tried, like, for example, like I cross train, and we'll get into that, but I play like paddle all the time to help with my overheads, and I absolutely love the sport, arguably more than pickleball. And sometimes I forget to lock my wrist when hitting a volley, and I drop my wrist a little bit, and I shank it. And because the paddle's so much heavier, the load just goes straight to my wrist, and it just like kills me because I just forget to lock it. And it's completely different mechanics from sport to sport. Sure. And, it kind of dings me for the rest of the day. But on that topic, let's talk, are there any benefits of cross-training with sports in general? If you're a tennis player, whether it's for rehab or just training, would you recommend cross-training, or for any sport in general?
Initially, yes, for me specifically. I know there's a whole topic out there about kind of specialization and specializing in a sport from early on and staying within that sport. And yes, there are some benefits there, but what's going to lack in some of the specialization is you don't get the overall athletic development and the many components of athletic development, which is power, strength, agility, flexibility, and so on and so forth, which you're going to get from playing multiple sports or training in different modes. Different modes can include HIIT, right? So high intensity interval training. Or like yourself, I'm taking paddle and pickleball. So they both translate to each other, but you have the ability and a really unique ability to then separate the two when you are playing in both of those. But there's so much crossover. And I would say there's very similar crossovers in tennis and pickleball. But then we talk about the nuances of like being at the kitchen and playing with your wrist more, right? Those are differences. But you still want to have the ability of like Can I accelerate and decelerate? Can I change directions? Can I move in a diagonal position, stop my position, and then come back to position? Right? Can I contort my body and specifically have body motor control to not lose balance and be ready for the next shot that's coming? Right? All of that is usually done if you do multiple things, because then you see a lot of different forces coming at you, the ability to react to those forces, and the ability to adapt to those things, become more efficient, more proficient of it, and now you're way more effective at what you're doing in your particular sport that you're doing.
Yeah, I think specializing in just one specific sport is doing yourself as an athlete kind of a little bit of a disservice, because if you're playing multiple sports, not only, like Carlos, what you're talking about, are you getting the additional benefits of playing between different sports where you're working different muscles in a different plane and a different motion, but you're also allowing your tissue that typically gets overloaded in your one sport a break, instead of doing it over and over and over and over again, which is like the paradigm with a lot of baseball players is, you know, the fall ball goes into like a pseudo winter ball, goes into spring ball, goes into summer ball. They're playing all the time, right? And it's a ton of volume for tissue that needs a break. And so cross training, I think it's great, beneficial for an athlete to just get exposed to different sports. Stressing your body is always a good thing. Like putting yourself in an uncomfortable environment is always good to load tissue and strengthen tissue. But it's really good to give your tissue a break from time to time. If you're playing all the time, it's a lot of load. And as you load a tissue up more, then your risk for injury goes up, right? So I think cross-training is really good in the minds of just keeping your athlete healthy.
Yeah. And I think one of the key things that we've done too is Henry and I have really laid out a plan according to like periodization. Like I think that's the caveat too, is having some sort of periodized program for yourself, that you will do some cross training here. You're going to do plyometric training here. You're going to do, you know, your strength training here. Okay, now you're in season. Okay, that changes. Okay, you're off season. Now that changes, right? Is having the overall concept and theme be all relatable to what you're trying to achieve in that entire year. Which I think Henry has done a fantastic job of doing that with your training specifically. It's not only integrating what he's doing in your physical therapy sessions, but integrating that into your personal training session and your sport performance training, right? And how that all ties into what you're doing on a daily basis, on a weekly basis, on a monthly basis, and then so on and so forth, right? Is that we're always having eyes on a plan that is happening. We call these microcycles, mesocycles, macrocycles, and that's how we work, and that's how our mind works when it comes to some of these, you know, cross-training methods.
Also keeping in mind the independent limitations that you might have, right? So every athlete's going to come in with their different preset of limitations. Maybe their ankles are stiffer, maybe their hips are more mobile, or whatever it may be, but we're keeping that functional tie in your movement, tying that into, okay, what do we need to improve sport specific wise? Like, all right, if we got to hit a 2E, we got to be able to get low. We got to be able to generate a lot of force. You got to be able to absorb that and power through it. So we got to have the mobility to get down there. We got to have the strength to get up there. Now, we don't necessarily have to hit, 200 2Es to get that done, right? We can load you in a similar fashion and build that strength and that range. And then also stress your body with plyos and whatnot, which kind of, prepare you for the motions that you're going to be in and the spots you're going to be in play. So it's all tailored to be individualized, right?
Yeah.
So.
Which I really love that approach. I mean, you guys have, just to tell the viewers a little bit about our schedule, we do strength training twice a week. One of the strength training is typically plyos, right. And then we do a PT session a week. The PT session could be whatever I'm dealing with that week. And then the strength training and PT are based off of your guys' periodization or just schedule on what you guys want based off my tournament schedule. Mm-hmm. So it is very, very tailored. Like, for example, August, I'm packed. I'm going to be gone half of August. So we know that. I tell you guys that ahead of time, and then you guys adjust accordingly. And I really like how you guys do that, rather than it's like I'm just coming to PT. It's the same thing every single week, and that's it. And in terms of like our plyos and our strength training, the video should be out by now, but it's very, very, very functional to the sport, which I love. Every time we go outside and we do rotational stuff, I literally imagine like I'm hitting a two-handed backhand, or I'm hitting a I'm hitting a closed forehand, or I'm now hitting an ernie. So like we do a sidestep to an explosive jump. Like that is literally an ernie. Or throwing balls in the air. I imagine literally just taking a step back and hitting it overhead. It's very functional, and I can see it, like the one-to-one correlation to my sport. Especially some of the lateral movements, that's pretty self-explanatory.
Sure. And you'd be surprised, like, I mean, there's so much research articles out there that states exactly that, and how much there's integration between a plyometric program versus injury prevention versus the ability to integrate into your actual functional board, your sport. We know that, and that's the reason why we integrate that into your functional training, is because how important that is into the ability to translate forces that you're trying to create on a ball to manipulate all over the court, which is why we integrate things like that method.
Yeah, and this is, we already talked about the importance of a wrist in pickleball, but I think pickleball is one of those weird sports where you don't need, for baseball, whether you're pitching or hitting, all comes in your hips. Soccer, whatever, kicking a soccer ball, all comes in your hips. Almost every other sport, your hips is what's generating the power. Yeah. Compared to the kitchen line, the only other alternative that I can really relate pickleball to in terms of not relying on your hips as much as like badminton, where you're just standing up and flicking your wrist. Right. I think that's a very nuanced thing that not many PT or even strength and conditioning coaches really know how to do, because it's less so. It's focused on hip mobility and like hip flexibility, which I'm working on. I still don't have. Rather than like yes, for ground strokes, the rotational power is important, but it isn't as important as say like the other sports where in baseball if you don't have hips, you're screwed. You can't rely on your wrists or even your upper body.
But I think in the other sports is like they're trying to create so much force on a ball. They're trying to create so much velocity on a ball that requires much more large muscle group recruitment. Whereas when you're doing the pickleball in the kitchen, that's really not the case, right? Like the case is trying to just get it back to the other position, or get it back into the kitchen, reset, get into position, and then rethink my shot as I'm trying to put it back in the kitchen to reset my position, right? So I think it doesn't require a lot of force. Therefore, or people that play pickleball can get away of not utilizing their hips in a very large muscle recruitment area, because I'm not creating a large velocity shot within that space. As soon as I get away from like the ground shots, I definitely need to create some large muscle recruitment, which why we always go for the hip.
It's a hybrid sport. You're going between one shot, you might be on the baseline hitting forehand where you need that hip involvement to generate a lot of force. You're right in the kitchen line, and you have nothing but arm to punch with, right? So you're messing between the two. So I think, if anything, sport-wise, it's really good to be mobile through multiple planes and multiple joints. And a lot of the tennis work I've done, and I'm sure, and the majority of sports stuff that Carlos has seen, they talk about like different joints being stable joints and different joints being mobile joints with a lot of movement. And what I think is really interesting about pickleball is you flick that so quick, right? So you're like going from, all right, I got to have my hips open me up and I got to generate a lot of force on ground stroke, to now I'm at the kitchen and now I can't really use that. And now it's a stable joint. Now I'm using it as a stable joint. What am I going to do with that? Am I going to use that to help generate more power with my shot? Am I going to use this to absorb power? With some of the shots, people are flying them at you. So it's like, am I just going to take this and reverb it back? So you're having to switch, like which one's mobile, which one's stable. And so I think that's really cool with the sport from a PT standpoint and from a performance standpoint, is I get to, like when we do our training stuff, I get to go like, all right, we're going to treat this joint like it's a stability joint. We're going to treat this joint like it's a mobility joint. We get to kind of play around with that. So we kind of make it hybrid for your sport too.
That's super true. Like, yeah, when you're hitting a third shot drop, and everything here is like stable, you're just moving it compared to when you're hitting a backhand drive, then now it's maybe a little bit more mobile. I actually that's actually true. I love that. Yeah.
This is like, I love this stuff. This is the stuff I'm like sitting down in my bed, reading a research article, petting my dog, and I'm like, hey, how can I optimize this guy's pickleball performance, right? Like, how can we change this? How can we change the landscape with this? Because like you were talking about, it seems like, and I'm sure you see this too, with, paddles are generating more power, and with more power comes more intensity, and with more intensity comes more physical demand, and with more physical demand comes higher injury risk. And so you get guys that are coming out there, they're really wailing on stuff and really hitting stuff pretty hard. You got to be physically ready to do it. And so, I think the whole like training aspect, Carlos and I have talked about this too. We think we're just at the precipice of this, right? We always attribute this to like what we've seen in golf, where like good old Tiger Woods kind of changed the landscape of that. Kind of was more of a recreational sport. He goes, hey, I'm a strength train. I'm gonna really get after this. Changes the whole landscape of the sport. I think pickleball is kind of in the same idea. Carlos and I totally agree on this. We think it's in the same kind of playing field where we expect players to try to optimize their game. And if you've got the top of the line equipment and the top of the line skill, your next avenue is, well, I should just be physically ready for this. I want to be as strong as I can, as mobile as I can, as fit as I can. So we see strengthening as far as like a progression program being something that's going to hit pickleball pretty hard. Yeah.
Which, speaking on that topic, I'm, obviously I train every single day, and way too often, sometimes including myself, I see these pros, like you're a professional athlete, and we have practice at 8:30, and they show up at 8:30 and just walk on the court.
Sorry.
And this is on the pro side of things.
Yeah.
Where more pros, more than 50% of pros walk on the court rather than actually warming up.
Sure.
And that's a stat that I've seen, and I've trained with almost every single pro.
Yeah.
And this is on the pro side of things. On the amateur side, I will never, ever, ever step in open play and see a player warm up. Ever. And now, obviously, I have a band in my bag. You guys have assigned me warm up, so I show up at least 15 minutes early and make sure to get that stuff done. Yeah. But let's talk about a good quality warm up for an amateur. Not even for a pro, it would be much more tailored, but for a typical amateur, what's a realistic timeline where they don't have to show up 45 minutes early and get everything done? A good 15 or 20 minute warm up. Is it dynamic? Is it static? What are they trying? What are they looking to do with their body?
Yeah, I think Henry can give more sport specific dynamic, but I like to do just universal stuff. Just get prepared for what's to come, right? And so core body regulation. Can I get my body temperature up a little bit, right? That's most important, because think of your body like with oil in its system, right? Something that Ninja's just kind of sitting there. The viscosity of that oil is literally high. It doesn't move as well. As soon as it gets heated, now I'm moving fluidly. Things are moving fluidly. It's the same thing in the body, right? We got to get that body temperature up. That helps muscles, tendons, ligaments, everything move really well. Joints moving really well. And that's exactly what we want to do. Get your body to now recognize the forces were about to come to you, right? Instead of just stepping on something and you have no idea what's about to happen. And so universally, 7 to 10 minutes, if you can, at the most. Give yourself 7 to 10 minutes prior to doing an actual sport, and go through an up and down motion of 0 to 10 yards, doing something down 10 yards, doing the same thing, coming back 10 yards, and then change it to another different movement. Simple things could be like, hey, every single step, I'm going to bring my knee to chest, knee to chest, knee to chest, alternate every single step, same thing coming back. Then I'm going to do something like a leg pull my leg behind me, get that quad engaged, hip flexors engaged, single leg balance, working on all that, coming back down, doing a side kind of like a groin stretch, lateral lunge position, both sides, going down and back. Then I'm going to go into a forward lunge, down and back. Things that you can incorporate into that lunge is I'm going to do a trunk twist within that lateral lunge, because I know I'm going to get ready for a movement that's going to be rotational, right? Then we're going to go into a hamstring. We call them Frankenstein kicks. Literally, you're standing tall, kicking one leg, alternating the other one, and kicking up and down, and then doing an RDL. That's our universal dynamic warm-up. That takes 7 minutes, but that's something you've done where you would have not done anything at all. And if those right there has at least targeted some of the tissue that you're about to be utilized on the court itself, and tries to at least gain everything within the lower body and the upper body to get it a little bit more targeted. So at least 7 to 10 minutes. And I love more dynamic warm-up rather than a static warm-up. I've never really seen some really benefits in an article saying that a static warm-up is better than a dynamic warm-up. Never really ever seen it. And it's not even more effective than that. So
just even touching into functional application, right? Dynamic is way more functional than static. I mean, you're never really playing in the game and you're just going to be like, hold on 1 second, let me just go stand and hold my calf in this position. It's not something that you functionally do. So you have to prime your tissue for the functional application you're going to put it under. As far as pickleball is concerned, as far as soft tissue, I would spend a lot more time with like a little bit of light load or little bit of light elongation of calf and Achilles. That tissue takes a lot of load when pushing off or accelerating from baseline to the kitchen. Hamstrings in the same sense too, because they're helping decelerate your leg, but they also help with accelerating your hip. So getting that tissue warmed up in that regard. And then rotation, back rotation, opening up, lower back, upper back, mid back, doing a little bit of like a single knee or double knee to chest, doing like some open books, world's greatest stretch. I take that one with you. We do that one all the time because it's a full body component, right? So I think, like Carlos was talking about, our dynamic approach is good, but I think some of your like bang for your buck, if you can get multiple muscle groups in the same go in a dynamic warm-up, is also a great thing if you're in a really big time crunch. So like having a good like 3 or 4 where like you talked about people literally walking onto the court, which is crazy to me. I need like at least 10 minutes to kind of get loose, right? Like a good go-to couple where you're like, even if I'm in a pinch, I can do these handful of dynamic things and I can get out there and I'll be in a good spot. Yeah.
That's spot on. I've since day one loved my dynamic warm-ups rather than static. And yeah, I haven't seen many results with just doing static before play. I've heard that after play it's more beneficial rather than before play, but getting into some more fun stuff. You guys know I love my Blaze pods. You guys know I love
them too.
Even before, and
Shout out Blaze pods, one of my partners.
Yeah, and if you guys don't know what Blaze pods are, they're these little things that look like this. You put them on the floor. You put them on the floor and they light up a certain color, and then you have to tap it when it lights up. So it trains a lot of coordination, trains a lot of reflex, and that's something that applies a lot in our sport. It's also something that's way more fun. So it makes training much more fun, and I really enjoy doing it. And we see a lot more coordination and reflex things in other sports too. For example, we have Colin Johns does it in pickleball. We see him, what he does is he literally has like, think of it as like a yardstick. He puts it up next to a wall and then looks at each specific foot, like back and forth, just to train his eyes. We look at Yannick Sinner. He sits on his back on the floor before matches, has his trainer hold the tennis ball. Tennis ball comes close to his head, comes back, and then he just has to focus back and forth.
Absolutely.
F1 drivers with the tennis ball drill, I'm sure you guys have seen that. They hold the tennis balls out, drop it. F1 drivers try to catch it.
Ever seen the one where it's like dropping the little sticks? They've got 4 of them and they have to try and catch those. Right.
Yes,
like
exactly.
all of those, right?
Lots of that, as well as like before tournaments, what I do is I do like with what my person that comes to tournaments, I have like a band and I do like 3 slides, and then he tosses me a ball and then I try to like catch it, and he tosses it, it bounces, it's a lacrosse ball and it bounces in a different spot every time, and I just try to make sure to catch it while making sure I bend and get deep in that squat every time. I think that's more like, I've seen that more recently, like, in 2 to 3 years. I think that's a lot more nuanced way to the point where I've used that in my lessons in my clinics. I'm like, you guys have now warmed up your body for 15 minutes. Now it's time for you guys to warm up your eyes, because we have to warm up our eyes the same way that we have to warm up our body. I often see, like, if my body's warm but I haven't trained hands, I go into a match and the ball just comes quicker than what I'm expecting. So how important do you guys think training reflexes and coordination is in relation to the actual like physical training?
And I think it's just super important. I mean, so I think when you talk about like training your eyes, right, it's very similar to training your dexterities or your extremities, right? You have one central unit, your brain, that is controlling everything else in your body, right? It's the ability to have neurocognitive tasks, right? That is the most important piece. The ability to then really be effective at controlling a lot of different things in your body while many things are going on. So a lot of multitasking. Your brain is responsible for so many things, not only of what's happening outside of it, but what's happening inside of it, right? So the ability to utilize Blaze pods is the ability to then be able to then perform a task in which we've asked you to do, but also try and get you to like get it on a light or something like that, right? We can even have you like, sometimes we'll have you count backwards by 3, starting from 50 while trying to get a light, right? there's so much research out there that states, and specifically in rehab, when we're trying to get you back to sport, if we don't start to test what your mind is doing and what your brain is controlling, it doesn't matter what your physical body is doing or capable of doing, because you don't have the control of what your physical capabilities is. And knowing from all the research that I've done, that's why I've incorporated, and you're about to see it today in your training, we call Hiko sticks, was another piece of equipment. It's really cool. Is utilizing blaze pods to, one, have fun, because it's so fun. I love it. we being so creative on things that we do with it, right? But two is to challenge you neurocognitively. Like, we understand if we can really polish up and refine what's happening between your brain and what's happening with your other body parts, we know then we can make you more of a machine, make you the ability to react really quickly. And we call kind of task stratify, know what's important and what it's not important, and complete that task in a way more less time, spending less time doing other things, and now become, like I said, more efficient and more polished.
I look at it from the distraction lens. So I take you through stuff like that, and I like to use blaze pods and all these other factors to see if the movement patterns that we've worked on have integrated. So when you don't have the time to think about what's going on because you have to react to the light or the ball or whatever's going on, I'm looking at it and seeing, are we in the same movement pattern? Are we loading the tissue the same way that we did before we introduced the stimulus, right? I'm trying to see if, like, hey, when our attention is deviated towards something else and we can't focus on the specific motion that we're working on, what does it look like? Because ultimately, when you play your sport, you're not going to be sitting and thinking about all the 8 or 9, nor do I want you to, 10 things that we've worked on in a session with how to squat or how to load. And it's a fun way to do it, but then it's also a great way for me to be like, hey, when you were distracted with this, I noticed this popped up or whatnot. So I look at it through that lens too, in the sense of, like, it allows me to see how integrated those movements are in, like, your innate ability to move in those specific patterns that we've worked on and kind of addressed. How, like, I guess how much it's like stapled in or locked in.
Mm-hmm. Yeah, and I reached out to Blaze Pods, and they literally gave me a discount. They didn't even send me out. So the fact that you guys got a partnership is so clutch. I need your guys' extra set, because I would use those literally.
I think it helps that we're medical professionals too. Like, we use it like in a medical facility.
Yes.
So they were like, well, we'd love to partner with you guys.
No, I absolutely love the stuff that we do. Like, we do whatever, we assemble like 4 on the floor, and then I do like a push-up, and then as soon as I actually push up, then I have to push a specific light. Or like I do a side plank, or like I put my elbow or just my forearm on a Bosu ball, balance on the Bosu ball, then I have to tap a specific light. Like, it's so much more exactly what you said. Like, one, distraction, like, am I turning, or like, am I trying, or like, I have to stay, like, my core has to stay engaged, and I have to make sure that my mind is in the right place. Because typically, like, when I, if I were to do an exercise without that stimulation, then it's just like, then it's just focusing on my body rather than my actual brain.
And there's a thing called mental fatigue too, right? So as you do that for longer periods of time, let's say you're doing that activity for 20 seconds, which could actually happen within the quick kitchen, right? 20 seconds of play versus like a minute of play or 5 minutes of play. Do I lose that focus? Do I lose that mental fatigue, throughout the space as well during my, my repetitions of doing the pickleball too. So trying to build that mental fatigue.
Yeah. Which I really love that you guys are pioneering that part of the game. And so what are some other creative pieces of tech that you guys have used? I know a few that you guys have used, especially during my testing, but what are some creative pieces of tech that you guys have used at RPI to really help enhance your clients?
Well, I'll let Carlos take this over. He's kind of the big tech guy. So
I'll say one, and then you can grab another one. One of them is like our force decks. I think since the introduction of like force plates, I think they've been around for, I don't know, like 15, 20 years now, but they've never been available to like the consumer market. They've always been available to like your higher organizations like Olympics and your professional organizations like the NFL, NBA, and all those. But those things cost like $30,000, $40,000. They were inflated into the ground. You couldn't move them, right? They were connected to this large computer essentially, and it was dictating all these metrics anyways. So you couldn't just get your hands on them, right? I would say about like 5-7 years ago, folks like Vold came out with these products that you can utilize them now and be the ability to transport them. And so ever since utilizing something like that, it's been giving us a wealth of knowledge on not only just return to play stuff, but the ability to give us more information on what your body's doing and certain movements, things that Henry and I geek upon. That's things that we translate very well when it comes to things like that, because then it translates to what we're seeing, what you're doing. We see it on court, but now it makes sense because I see it within numbers and what we're doing with those force plates. And I can do force plates for a lot of things, from jumps to upper extremity stuff, to squat metrics, right? And looking asymmetries, what's your right leg doing versus your left leg, and so on and so forth. And so the introduction of just that itself within our programming and within our PI has definitely elevated us a lot, for sure.
No, I'm a big fan of the dynamo. And coming from traditional PT, you're taught muscle strength testing, and it's literally just like keeping a timer in your head.
Give them a description of what the dynamo is. What is that?
Dynamo is dynamo. It kind of looks like a little lightsaber hilt, and it's got a little thing on the top of it. I love it. It's cool. But yeah, I think what's amazing about the dynamo is the amount of detail that you can assess as far as muscle force output. But then it also has a metric that determines like percentile based on age, like where you should be, right? So it tells you exactly where you are percentile wise. So you could be totally symmetrical, but your quad strength's in the 20th percentile and you're in a sport that demands way more from that tissue. That tells us, hey, we should really be working on some quad strength. And in sports and athletics, I mean, the difference between a few newtons here and there, it could be a difference between a few points here or there, and it could be a difference between first and fifth place. So it's all this really fine tuning, right? These like really small teetering scale. And so I think the dynamo is great for that, in the sense that you can really kind of get some objective measurements. And I love objective stuff because objective is always unbiased. You take people through virtually the same tests that look at the same metrics, and if you did something that was helpful, it's going to show. So I think the dynamo is great in that regard.
Gotcha.
Yeah, I remember doing both of those.
Yeah.
Yes, I actually love the dynamo because I actually firsthand saw my improvement.
Yeah.
Like I remember doing like you'd put the lightsaber hilt right here,
Yeah.
and I would push out and try to show whatever is this external rotation.
Whoa.
Then you'd put it here, and then I'd try to do this, put it on top of my quad, and then I'd pull my quad up.
Yeah.
Did it with like, up and down, like every single thing, and then seeing how that improved over the past month or two. Same, I don't think have we done that with the force plates?
You did like the jumping, where you did like the double leg, single leg jump. But I think it also ties into just like the system of Volt, like the ability for you and I to sit down and for me to be like, hey, like here are some numbers that we can look at. And then you feel like it's a good understanding of like, oh, I know exactly what Henry's talking about on what I need to work on, or what Carlos is talking about, what I need to work on, versus us using some of the old metric systems and it being like, well, I have no idea what this means. But this is something I can physically see and kind of alter.
Yeah, because then we take those numbers and then we translate it into, okay, what muscles are not performing the way they should? And then from there, we prescribe exercises so that we can improve those things. And that's where it's been super helpful for us. Is in normal traditional PT senses, we do what is called a muscle grade strength, essentially. So let's say I was going to test you on that. I literally use my hand and I try and push it inwards. And I grade you between, not for to be super technical, 1, 2, 3, 4, 5, right? And if you're like, oh, I held it there and it didn't break me because I was held in there, then I gave you a 5 out of 5. And I was like, well, that doesn't tell me much. Like, that doesn't really give me an objective measure of how much force this one's producing versus this one. And then where is that relation to like your sport that you're playing that I really want to see? So something like the dynamo has definitely given us some things like that too. So
that's why I think high tech or just tech is so important in the world of PT or even strength training, because it really does enhance it. It's not like gimmicky. Sure, there may be some gimmicky stuff. Like I'm not going to use that shaky dumbbell,
Right.
but like there are some really cool stuff that you guys have applied. But yeah, I think, for example, maybe I'm comparing two completely different worlds, but like in terms of content creation, it's like finding the line between gut feeling or like intuition and then using the numbers.
Yeah.
If a specific video takes off, do I do it again because the numbers are good, or do I go with my gut feeling on another video?
Yeah.
It seems like a lot of what PT is less of gut feeling, more of just application of numbers.
Yeah.
And there's almost like never, you guys will always just look at the numbers, look at the data, and then use that to figure out what the problem is.
And I think maybe Henry will attest to this too, is that there's so much gray within PT, right? And so we're trying to minimize the gray. We want to become more clear and have more clarity with what's really going on with you. Are my programs really working with you? Am I, providing the appropriate exercises for you? And without so much data, that's hard to evaluate. Not because I want to have my ego and say, yeah, whatever I give you, it's going to be the best, which there are some PTs out there that do that. But if the data doesn't suggest that, then I check myself at the door and be like, hey, then there's something that I'm not prescribing that really is not, being successful here. So
I think it's a marriage of qualitative and quantitative. So looking at the numbers, and you have your objective measurements of this person generates this amount of strength, but then your qualitative is how do they move? How does that look? And that's always kind of hard to objectify, right? So it's assessing their movement in that area, supplementing it with the objective measures you get of strength, and being like, hey, like your weakness here, it's visible with this motion, or this motion here is leading to weakness here. And they are so interchangeable. So I think it's meshing them too. But yeah, it's a ton of gray area. It's a ton of figuring that out to some regard. But I think the beauty of PT is when it's like all encompassing that, right? Where you're going off of like how your patient feels. There's so much subjective stuff, right? Pain is totally subjective. I can't jump in your body and go, yeah, I know exactly what's going on with that pain.
That's what happened. Like when I was trying out all of my different facilities, when I had back pain or when I've had pain in the past, literally I go in, I'm like, I have back pain. They touch it and they're like, oh, like this is what's wrong with it. I'm like, dude, like, is it really what's wrong with it? Like, really? They touch it. They'd literally touch it or be like, do a rotation. Then they'd be like, this is what's wrong.
I mean, if you had like a big gash in your back, you're like, well, yeah, no, duh, that's the thing that's bothering you. But yeah, I think it's a two-way street. And Carlos and I think, are really excel at that. We want to make sure that you feel like your point's gotten across to us and that our point's gotten across to you, and that there's give between it. It doesn't have to be, hey, it's my way or the highway, or where you feel like you have to stand your ground, where you feel like your voice isn't heard. Yes. It's back and forth, and the same kind of stuff with this whole PT approach. We've learned, and through majority of our course, like descriptors with pain and what pain can kind of mean in that kind of sense. So in a kind of PT detective sense, yeah, we have the idea of like maybe what's bothering you. But we're both very empathetic people and can understand what our patients are feeling as far as like a pain standpoint, but I can't jump in there and do that. It's totally subjective. To some degree, there's objective stuff that can really help with that, but then there is the whole subjective area of it too. So it's a marriage between it all.
Yeah.
It's a hodgepodge.
Yeah, you guys are gonna love this segment. This is gonna be. You guys are gonna look at me and be like, "This guy is so stupid." But I hope this really does work. I really hope this works. So when I'm on a plane, I don't have much other than like downloading videos on YouTube and watching them, or either sleeping or something. Yeah. The other thing I have is this game called Geometry Dash. If you guys are familiar with that game, I hope some viewers are. But it's basically a game where you're like this block, and you try to and you tap, and every time you tap, you jump, and you have to go. Okay. And so I do that on the plane. Just to show you guys, this is what Geometry Dash is, okay? Okay? So let me show you. There's easy, then it goes, then it goes to like medium, then it goes to hard. And so then it goes all the way to like insane.
Oh, wow. This is neurocognitive.
Which are these, and it's literally a game where you have to tap, and you have to go through.
Essentially, to pass the level, you have to literally, like almost like Super Mario World.
Yeah, and you do that, and so you literally just tap, and it gets like very, very fast.
Yeah.
And I view this as me like training reactions. I don't know if that's dumb or not. And so what I've done is I've tried, and I've beaten a bunch of levels with my tapping with my right thumb as well as with my left thumb. Mm-hmm. And I don't know if that's applicable, but I view that as me using like both sides of my brain. And I think it really does help with cognition or just overall like coordination.
For sure.
I don't know. I enjoy it.
I mean, I think you're thinking way more than probably the average person out there. Like, honestly, like, yeah, no, but I would say you're like, I think you're on the right track, like for sure, like using your right hand versus your left hand because your right side of the brain controls your left and then so on and so forth. So I think for you being so like ambidextrous in the things that you do, specifically in football, right, that is super applicable to you. Like you want to have the same type of control with both sides and same reactionary times with both thumbs or wrist or whatever that looks like. So utilizing something like that. As a matter of fact, we utilize things like this in our concussion training. And so people that do suffer concussions, this is part of their neurocognitive tasking, is ability to go through things like this because it is so difficult for that. But when it comes to now like polishing yourselves up, using things like this, I mean, it can be pretty beneficial when you're looking at some dual tasking and cognitive stuff.
Yeah. I say, like, if you guys haven't tried it, please try it out. Try it out.
I'm gonna try it.
It's
The
fun.
only thing I might get addicted. I love games.
I just do it on flights because it's the only one that like doesn't require much data.
Yeah, gotcha.
So yeah, like moving on to the last thing, just to wrap things up, I have like a few things that a lot of my viewers would just want answered. Feel free to dive in depth or just keep it very, very quick. Playing through pain. Should you play through pain? If I've been in matches, maybe it's definitely different on the pro level, but on an amateur level, whether you're playing a tournament or not, should you play through pain if you have a little shoulder injury or if you tweaked your shoulder?
You know, I think there's so many levels to that, honestly. It's like like say, for example, like my professional Olympic athletes, like, or these guys that are getting paid millions of dollars, like they may not know what that threshold is. Like they're expected to play through pain. For individuals that have a little bit more control over what they do, you know, usually my suggestion is if something's bothering you in between, let's say 0 through 3 to 4 out of 10 pain, that's kind of okay. You can kind of play through that. I would more suggest playing through 0 to 2, 0 to 3. As soon as you get into like the 5, 6 and counting out of 10 pain, like your body will adjust. Your brain is going to adjust specifically for that. It's going to want to guard. It's going to shut down. And because you didn't listen to it during your playing time, what do you think is going to happen as soon as you step off the playing field? It's going to hurt more. And the next day it's going to hurt more because your brain suggested that you did not pay attention to what was going on behind because your brain was trying to tell you that it was painful. So I'm just going to increase my intensity the next time. And so now you're playing at a higher level. And so you keep doing that, right? It's this reciprocal notion. And once we get into that reciprocal notion, pain has a funny way of establishing itself in that way and now becomes chronic in nature. And so now my nervous system is now becoming adaptable to that chronic nature of recyclable pain. We want to reduce that. And if you have a little bit more control over that, playing through 0 to 3 out of 10 pain is okay. But understanding if I start experiencing more pain than that, I need to start thinking about modifications for that. Maybe it's less training time. Maybe it's I go receive some physical therapy, or I need to modify some of my playing, perspectives and things of that sort.
Yeah, and it depends is like the best answer you could give in this situation. He really teed it up, but I mean the best way to say is like each tissue responds differently to whatever mode or medium that you move it through, and so by that degree there are different levels of pain. Research is different on like what tissue is okay to have a certain level of pain with versus other tissue. They have all the different types of pain, and so there's all this just mess of stuff. So the best answer, it depends. And the biggest thing is it just depends on the demands of the athlete. Yeah. If you are in your championship game and you're in the third set and it's knotted up at 9-9 and you've got some pain brewing, it's a judgment call, right? And so it depends on if this is in the middle of practice, if you're in off season. There are all these different factors that are in play with that. And so I would say the best thing to know, right, in that situation is just have more education about it. Awareness of your body, awareness of the pain that you experience in your body, whether it's someone that you can consult with or talk with, is your best avenue in that regard. So the more comfortable and aware you are of just the topic of pain, the better decision you can make for yourself.
Yeah, and I'd say the biggest thing too is just the fear of pain too, right? Like we all want to build resiliency within the body and the tissue, right? So you shouldn't be like, oh, I'm experiencing pain. Okay, I'm gonna shut it down. It's like, no, we don't want that either, because now your brain has an ability to even adapt to that. And see if it can work itself out. And so we want to build resiliency within those notions. But at the same time, we don't want to fear that I'm going to be injured more or fear that I'm going to be hurting more at the utilizing, like Henry said, is the awareness and the education behind it will help to kind of mitigate those pain intensities.
Yeah, no, I asked a simple question. That was the smartest shit I've ever heard.
If you think that's cool, there's a whole subsection PT on pain science and pain education, like where we were taught, like, so this, it's a whole other branch of PT. So
It's ingrained.
Wow.
in us, for sure.
Yeah, no, that makes complete sense. So,
Hopefully that's good for the viewers.
no, totally. What are some of the biggest myths about physical therapy or injury rehab in general?
that it's massage is my biggest thing.
Or physical torture.
Okay,
Like,
they're
you know,
extremes, I guess is the best way to
like-
put it. Like, you know, some people are like, well, I go in and I get a little massage from my PT and then I walk out. I think the myth is that you're not going to get loaded. And I think that's what's changing with a lot of PT nowadays, at least with updated research, is PTs in the sense of load, meaning like a lot of strength training and taking people through exercises and kind of really straining tissue to improve its strength. I think the main nomenclature with PT is that it's a little bit more of the, you go in and get your little nice stuff and kind of move on from it.
Yeah. And I think the other myth too, I would share is like, not all PT is the same. Just like not all doctors are the same. Not all orthopedic surgeons are the same, right? Just because you go to one physical therapy clinic is that you're going to receive that everywhere else. It's not. You know, with the caliber of Henry and I, like we feel like we're completely different from what you're going to see at every other clinic. And for those reasons alone, just like anything else you would do is do your research on any PT that you're going to go see and see what type of expertise. Maybe do a phone call. We like those called discovery calls. Hey, give us a call. Talk to us and we'll educate you and making sure that it's a good fit for you. Because we want to ensure that one, it's a good fit for you and that you think it's a good fit for you. Because if you think you're going to have a really good outcome here, there's 50% more chance that you are going to have a good outcome here.
What do players get wrong about recovery timelines?
I think there's so much out there, Jack. I think you can find that, you know, through Instagram, through YouTube, through Google, through ChatGPT, right? It's so easy to go input how long should an ankle sprain last. The fact of the matter is that not all injuries are the same, and that every single one of those injuries have we call grades. And every grade is different. Everybody's healing ability is different and capacity is different. Everybody's recovery is different. And the ability to offer treatments is different, right? So all those come into play. Is there a generalistic universal timeline? Yeah, because we call tissue healing timelines. But that doesn't mean that just because you had a grade 1 ankle sprain, you're going to be ready in a week. No, because there's so much to go beyond some of those things. So it's always making sure that you consult with individuals like ourselves, because then we're going to give you the best education behind what actually transpired here. How long do we think it's going to take on an expectational level or anticipated level, and then give you some buffer zones in between those. And then we tailor into what are your goals, what you have coming out of that.
I'd say like hearsay. Like I'll have patients that'll come in and they'll be like, well, this is crazy. I talked to so-and-so, who's a friend of mine, and they said it was going to take me 2 weeks or it was going to take me 8 weeks or whatever. And it's establishing, I think what it is establishing the time frame before getting any other input. It's like once you hear someone say one number, you're like, done. All right, 4 weeks, that's what's going to be. I'm going to cement it as such. And then you meet with someone and you're like, well, okay, well, there's all these other factors and, you know, we're not quite there yet. And there are these other things we're supposed to work in. And I think people want to hear, and like in the majority of the world, they want a quick and easy solution. And so they'll take the shortest number or they'll take whatever number they hear first, and that'll be the number they pick, regardless of the other feedback that they get. And so sometimes you have to kind of deal with that. So.
Speaking of quick and easy solutions, this could be bad for the viewers, but I have one personally. One must-do stretch for pickleball.
Must-do stretch.
Yeah, one.
Wow. Hamstring scoops. Get calf and hamstring in one go. So I think it's great for a little.
I think when he wanted to say it earlier is the world's greatest stretch. That world's greatest stretch incorporates a lot. That's the one where you're like in a lunge position. You put one hand down and you do like the rotation pieces.
Literally the
like
one
I feel like that can incorporate a lot of movements that can transpire during the game itself.
Yeah.
If you're going to do one, right,
Yeah,
for
yeah.
the rest of your life or something like
I
that.
think bang for your buck, that is the best one.
Yeah.
Because I do that before warm-ups, going up and down the 10 yards that you were talking about.
Yeah.
I do that, and then so I lunge, rotate, and then lean in even more.
Yeah.
And then before I come up, I kind of lean back so my hamstring gets stretched.
Yeah.
And then I lean forward and then step through.
And so the world's greatest stretch has so many variations to it that you can do, and that we can possibly, show the viewers next time is all the different little things of just positioning your body will then incorporate a different muscle group, honestly, from those positions, which I think can have, like you said, the best bang for your buck.
Mm-hmm. Most underrated muscle group to train?
Calf. Easy.
Carlos calf.
No, I've been reading a lot of research, and calf is really big in forward propulsion and sprinting and speed. And what sports are you not playing where you involve some kind of speed and sprinting?
Yeah.
And I think it's something that's totally overlooked. People just train quad, hamstring, glutes, anything as far as like hip and thigh, and they go, well, whatever. It's just true. But then when you go to the gym,
I do that too.
when you go to the gym, right? The gym bros, they walk up and they're like, bro, how'd you get those calves, right? So like it's amazing when you show up and you have massive calves, but you don't have to have massive calves. It's about having calf strength and the range and the motion you need. But I think it's a totally underworked tissue.
I think from what you just stated earlier, like wrist, forearm muscles, honestly. Like when was the last time you ever did like a wrist roll up, right? Or using flexor muscle groups, right? Things of those sort. And there's so many different exercises that you can do with pronation, supination, right? To help you with some of these shots that you're incorporating more of the wrist and forearm stuff too. So most underrated stuff.
Yeah. What's the quickest way to bounce back after a long tournament?
Rest.
Yeah.
Rest.
Sleep.
Rest, sleep, take
And
care of your
that's
body.
about 6 hours on a plane.
Hydrate.
Yeah,
Your
sure.
body needs to recover, right? And so you have to give it the time to recover.
Right. And I think things like the Normatec recovery sleeves, right? That those are big because those are going to help kind of circulate some of the fluids that are happening like in the dependent positions of your lower extremities, right? Things like that. Vibrating massages, because the vibration itself is what lends it like fluid movement, more active fluid movement, and then you do the massage piece, and so it gets that fluid moving better, anyways. And so, like you said, fluids as much as possible. Get water intake, right? Whatever you just lost. 2% of loss of hydration is actually equal to dehydration. So looking at that, that's important. Your nutrition, making sure you got plenty of carbohydrates. And number one, sleep. Yeah, pasta, get it in. And then sleep, right? Like that's the only way your body's going to recover. It shuts down, it learns about itself, and then regenerates whatever it needs to regenerate.
Yeah. And yeah, that's something that I struggle with because I stay up late working.
We're harping on you.
Yes, I know.
Last one. What's one thing you wish every athlete knew about their body?
I think for me specifically, because like there's so many levels to that, right? We do what's called a functional movement screen, and we look at your movements from a very fundamental movement. If everybody could just understand how it moved fundamentally, for example, an overhead squat. What does it look like in overhead squat? Can you do a squat with your trunk upright and your heels not coming off and your knees collapsing, right? That in itself tells us a lot of information just from doing movements like that. We take you through 7 movements of a functional movement screen. And that in itself, if you were to understand just how well fundamentally your body moves, dude, that's a recipe right there for a lot of things to be created in a program. And then moving on to like strength, power, and all those things. So
Oh, absolutely. How people move. I feel like I talked about mobility for like at least 40% of this podcast. But yeah, how people move. I wish athletes could take a step out and see how they would move in their sport. Or, I mean, there's so many athletes that look at film, but they're not looking at film to look at their body movement. They're looking film to dissect what the other person's strategy, right? To determine what the other person's going to do or what other movement's going to happen there. But I think knowing what your body is doing in space and knowing the realm of what you're physically capable of doing is so important. And that added knowledge allows you to really determine like when you can push it, when you can dial it back, gives the athlete more awareness of what their capabilities are. So yeah, that's what I'd say.
That's true. Maybe it's cognitive bias, but yes, I mean, it's crazy looking back at some of my film like 2-3 years ago where I used to lean rather than bend. It's like looking back now, I'm like, dude, you're stupid. How did you not see how bad that was in your body? But I didn't know because I'm looking at strategy.
But you also knew that from experience too, because of what it led to, right? Like some of these aches and pains that you're experiencing could very well be related to how your novice movements were versus now your more mature movements.
Yeah. One thing that I would say, just to tack onto that last question, was like, it's so important that your mind is also as committed as your body. Where like, I think, I mean, one of the coolest like feats of man was when the world's strongest man lifted, what was it? He lifted like 1,100 pounds or something.
Yeah, something crazy.
And he talked about like how he truly just like, it's not like physically possible to do it. The only way that he was able to do it was by engaging more of his mind, by thinking that he was lifting his kids under a car that was like about to fall on him. So it's like, if you engage that part of your mind, then you're able to do feats that typically are not possible. Same with David Goggins.
For sure.
And that's a different aspect, right? That's a life-threatening, life-saving situation, right?
You can engage that somehow.
And that almost, allows more percent of your brain to be more active towards its muscles versus like organ function or things like that. And now I'm recruiting way more muscles and more recruitment of muscles. So now everything is acting all at the same time, and I've got to save my child. That's quite different, right? And so unlocking some of that could possibly give you a little bit more edge on optimizing your performance too. Yeah. So I understand that.
Oh, totally. Well, I know we covered a lot here, and I know like not only me, but the viewers captured a lot of information. If they take away one or two things, that's a bunch of stuff that they have to, that they now took away. And I'm going to be doing some more research after listening to this as well. Yeah. But you guys have been awesome. I'm really happy that I've been able to partner with you guys, and we've been able to grow and continue our relationship. But thank you guys. Thank you, Reyes Performance Institute, Carlos and Henry, for coming on. You guys have been amazing.
Thank you guys. Hope you guys enjoyed it.
Yeah.
Appreciate it.
Thanks.